The most common question that I get is, can you get rid of my hump, or can you make my nose look smaller? Usually the answer is yes, but then with that, there are angles of the nose to the lip, definition of the tip, sometimes straightening the nose, and those types of things are all individualized for each patient. For a rhinoplasty surgery, that can vary a little bit depending on the specific rhinoplasty, but in general, most of my patients are back to normal day-to-day activities within a few days. Now, they may be visually swollen and bruised, or maybe have splints in place, and so they have to sort of figure out their comfort level being out and about in public with splints in place and things like that. But if they're comfortable with that, as long as they're not doing any vigorous activity, they can usually be back to normal day-to-day life within several days. So an open rhinoplasty versus a closed rhinoplasty are really just the access incisions that are used, either only inside the nose, inside the nostrils, or along the septum, or if it extends across the columella, which sits between the two nostrils. The difference between an aesthetic rhinoplasty, which I specialize in, and a functional rhinoplasty is that you're changing the outward appearance of the nose with an aesthetic rhinoplasty, whereas a functional rhinoplasty focuses more on breathing issues. So the day before surgery, we just recommend that people are taking good care of themselves and their bodies, staying hydrated, eating protein, and maybe getting a good night's rest. On the day of surgery, we see them prior to the surgery. I'll go through all of their instructions for after the surgery, do some marking, make sure all of their questions are answered before they go back. Typically, we give them a little bit of medication to help ease their nerves and get them back and off to sleep as comfortably as possible and as quickly as possible. There are some variations between different patients in terms of recovery for facelift, but in general, you're going to have some swelling and some bruising. Most of that goes away in the first 2, maybe 3 weeks. Sutures usually come out after about a week or so, and people can start putting makeup on their incisions within about 10 days. People are back to normal day-to-day activities within 2 to 3 days in general, as long as they're not doing any vigorous activity. At the end of the day, people that are thinking about facelifts need to determine if it makes sense for them. Once you've had a consultation, you have a better idea of what goals can be reached for you, you really have to decide, how much does this bother you? How much would it improve your quality of life? How much happier would you be when you look in the mirror and see the results that we're talking about delivering?